Turning our attention to blood in the lungs, vasculitides, we described just now, Goodpasture syndrome, are divided into the angiitis, such as polyarteritis nodosa, dermatomyositis, and recently capillaritis, and granulomatous form of vasculitides, which includes Wegener's, such as the classical as well as the limited, the lymphoid, the necrotizing angiitis, and the bronchocentric granulomatosis. Occasionally, we may see mixture of both the angiitis and the granulomatous lesions, and this can be seen in the hypersensitivity angiitis, the rheumatic, and the temporal arteritis. Fancy and other authors have described vasculitis into the following: systemic necrotizing vasculitis to include polyarteritis nodosa, allergic angiitis, and the granulomatosis of Churg and Strauss syndrome, and the polyangiitis overlap syndrome. Another group is the hypersensitivity vasculitis, secondary to serum sickness, drugs, the Henoch Schönlein purpura, infections, neoplasms, connective tissue diseases, and congenital deficiencies of the complement system. Other vasculitides will include Wegener's granulomatosis, giant cell arteritis, such as temporal arteritis, and the Takayasu, or the so-called systemic arteritis. And finally, there are miscellaneous forms that include Kawasaki disease, the Behçet disease, and Buerger's disease.